Hi everyone, welcome back to the channel. Today we've got a high-yield clinical scenario that's going to test your diagnostic reasoning skills. Let's dive in. So, a 16-year-old high school student has been dealing with burning pain in her upper abdomen for the last 2 months. She says the pain gets worse about an hour after eating. A few weeks ago, she had a short episode of diarrhea, but that went away on its own. No nausea, no vomiting, no medications. Her vitals are totally normal, and on physical exam, her abdomen is soft, non tender, basically unremarkable. So, what's going on here? What test is going to give us the clearest, most definitive answer? So, we have barium solo study, we've got direct visualization with upper endoscopy, we've got cross sectional abdominal CT imaging, we have a stool testing for intestinal parasites, and we got bacterial stool culture. Alright, let's go through these one by one. Option A. This is an imaging test where the patient drinks contrast and we take x-rays of the esophagus, stomach, and duodenum. It can show ulcers, but it's not as sensitive or definitive as other options, so not the best choice. Option C. CTs are great for many things, appendicitis or detecting masses, but for this kind of chronic postprandial epigastric pain with no complications, CT is overkill and not diagnostic. So we can scratch this one off. Option D, stool testing for parasites. She had a brief episode of diarrhea, but it resolved. That's not consistent with the parasitic infection using chronic burning pain after meals. This option is a distraction. Option E, bacterial stool culture. Again, same logic. A culture would be useful in acute infections, but not for 2 months of post-meal epigastric pain. Not the right fit. Which leaves us with option B, upper endoscopy. This is the gold standard. Why? Because you can directly visualize the stomach and duodenum, identify ulcers, and even biopsy for H. pylori if needed. This is the test that confirms the diagnosis. If you see a patient with chronic meal-related epigastric pain and a normal exam, think about peptic ulcer disease or gastritis. And remember, endoscopy is your best diagnostic tool. It gives you eyes on the problem and lets you grab tissue samples at the same time. Alright guys, that's it for today's question. If you found this helpful, smash that like button, subscribe for more high-yield clinical reasoning breakdowns, and drop a comment below. Which GI topic do you want me to cover next? See you in the next one. Thank you.